All right, so patient presenting to the clinic with a FOOSH injury. They stated they were walking on some ice and slipped and fell, falling on their wrist extended. First things first, I am checking to make sure the scene is safe, but we are in the clinic, so the assumption is that everything is okay, and the scene is okay to work in. I am wearing proper PPE, which would include gloves for this, as I will be touching the patient's arm and hand. So I'm first going to check CMS. So I'm going to take the pointer finger. I'm going to ask if they can feel this. I'm going to ask if you can move your finger. And then can you close or make a fist at all?
Slightly.
Patient says they can slightly close it, so we're going to be a little more cautious with that piece. I'm then going to squeeze the fingertip, make sure that it's blanching and that we don't have any interruption of the blood vessels to the wrist, which it looks good. So my next piece, I'm going to take my SAM splint and I'm going to have the patient place their hand at the end of the SAM splint, keeping the wrist neutral. And then as I come over top, making sure that I then fold the SAM splint slightly around the arm. Just so that it is a comfortable fit, so that when I wrap it with gauze to hold it, it is comfortably around the patient's forearm. Doing all right?
Doing good.
Then after I apply the gauze, keep the SAM splint stable around the wrist. I am suspecting a fracture of the distal radius. So I will palpate it. If you're comfortable with that still. I'm actually going to recheck CMS. Can you still feel your fingers and feel your thumbs?
Yep.
Still able to move them a little bit? Okay, I'm going to squeeze your thumb now and assess, make sure that it's still blanching for us. Good, still have proper blood flow. And again, we'll palpate that distal radius. Is there pain with this?
Slightly, yeah.
Some pain. Okay, check the other side. There is some palpable crepitus on the distal radius. Again, assuming then that it is a fracture of the distal radius. I will have you lift this up for me, please, if that's not too uncomfortable for you. And now we will be getting the sling on so that the patient doesn't have to worry about putting the wrist in any awkward positions and that it can stay stable for them. Is that comfortable? Okay. Make sure you spread that out enough so that it encompasses onto the elbow. Make sure to bobby pin this so the elbow stays within the sling. And after we've taken care of the injury and we've splinted properly and slinged it so that it can stay stable while we're assuming a fracture, the next piece would be to refer up to an orthopedic surgeon and an orthopedic specialist, and or to determine the severity of a fracture and to get some imaging for further management. After that, I'd probably manage with some rehab later on when it is recommended.